Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of future patients. Remember, in the description of this video you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis of our publisher Clinical Hypnotherapy, registered with ISBNs. Direct Clinical Hypnosis, Treatment Design, Part 2. We are going to see in a diagram the primary, secondary and tertiary exercises, and how to combine both exercises. Where to put the primary exercises, where to put the secondary exercises, where to put the tertiary exercises, and the order of both. Primary exercises. Before therapy. Cognitive. Aversive. Behavioral. Positive reinforcement. Negative reinforcement. Self-esteem. Self-control. Self-concept. Crisis exercises. Room. Room 25 steps. Enlarged room. Salivation. Self-hypnosis. Trapeze artist. Webet. Your favorite place, etc. Post-hypnotic command. Whispering. Secondary exercises. After the whisper, the corresponding secondary exercises are put in place, always depending on the disorder and therapy to be followed. This is where the therapist's experience and criteria come in, to know which secondary exercises should be combined with the primary ones. Deletion of obsessive thoughts. Total emptying of obsessive thoughts. Negative and positive consequences. Completion of therapy. Celestial Sanctum technique. Sponge exercise. Mirror exercise. Warp technique. Stimulating defenses. The beacon of hope. Fog exercise. Healing the past. Hypnosis of forgiveness. Coe method. The 7 energy points. All positive. A drop of happiness. Goals. Robot. Total mental emptiness. Connection with the inner body, etc. Tertiary exercises. These exercises are based on self-relaxation, followed by visualization, where the patient visualizes how he or she achieves his or her objectives, goals, recovery from his or her disorder or illness, etc. The relaxation and subsequent visualization must be done by the patient himself. If the patient has difficulties with this, then we can record a relaxation exercise followed by a positive, creative and guided visualization on a USB, so that the patient can listen to it as many times as necessary. In this section of the primary exercises, it is not necessary to put all the exercises with the exception of the before therapy exercise. The ending, the key, and the exit that will always be included from beginning to end in any treatment. This will depend on the disorder to be treated and the therapist's criteria. Within this section, we also have the aversive exercises, punishment. These are not always included in the treatment. In the section on crisis exercises, only one exercise will be used, with the exception of the exercise of the room and salivation that can be combined perfectly. In this section on secondary exercises, It is of course not necessary to include all the exercises. This will depend on the disorder to be treated, on the therapist's criteria and experience. In the section on tertiary exercises, this should be done by the patient during the therapy and also after the end of the therapy as a reinforcement, as many times as the patient wishes. The important points in all therapy: trust in the therapist and therapy to be followed, listening to what the therapist says, and above all, understanding what is being listened to. To achieve the 3 points, the patient has to learn to eliminate the rubbish: negative, inadequate and obsessive thoughts. Once this has been achieved, he must learn to stop them and not let them enter his mind. Of the 50,000 thoughts we have every day, 80% are negative. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Suicide Part 1. Remember, with the description of this video, we can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish, so if you're interested, do not miss our next videos. Thank you very much.